Hi, I'm Mudit. I'm CEO and co-founder of Dozee.
What do we understand by beyond care, ICU care?
So, if you look at it, right, the landscape of India is nearly around 20 lakh hospital beds. And out of that, only 1 lakh hospital beds are continuously monitored, right? And rest 19 lakh beds in India are monitored by nurses through intermittent spot checks. What do we mean by monitoring beyond ICU is exactly this, right? That how can we get this continuous monitoring, high quality care to each and every patient bed, even outside of the ICU as well.
Okay. How is Dozee enhancing critical care in India?
So Dozee, first let me tell you what is Dozee, right? So Dozee stands for Continuous Connected Remote Patient Monitoring System. When we started Dozee, right, and we wanted to create a technology that can bring digital transformation at scale, at a scale like India. That's where we realized that whatever technologies which we already have, right, are limited when it comes to complexity, when it comes to affordability, and so on, right. And Dozee is a contactless system, so there's a thin sheet of sensor that goes under the mattress. Patient doesn't have to do anything whatsoever, simply just lie down on the bed, and just by the virtue of that, Dozee monitors the micro vibration produced in every heartbeat, respiration cycle, and so on. And using AI, we convert this into different biomarkers so that continuously patients' health can be monitored without the hassle of any wires, electrodes, or patches. Once we have this continuous stream of data coming in, then we use our next layer of AI to convert these biomarkers into trends and reports. And if any patient's trends are going in high risk zone, the AI identifies it, and using early warning system, we flag this patient to the healthcare providers in time, and thereby Dozee saves life. Now this translating into, so this is what Dozee does, right? Currently Dozee is live in more than 200 hospitals across India, and we are very fortunate to have hospitals like Apollo, Hinduja, Breach Candy, Ramaya, Bellevue, right, from different zones in India, and many, many more. Right, they are using it, and they have reported significant reduction in the code blue events, which stands for the mishaps which happen outside of the ICUs, a significant reduction in that, a marked improvement in the nursing efficiency, because the entire digitization automates a lot of the work that nurses otherwise do manually. And last is also it improves the patient satisfaction as well, because they have an assurance that every minute, every second they are being monitored, and if anything happens to them, immediately the care will be provided to them. So that is how Dozee is creating a marked difference in the way healthcare is delivered in India. And our ambition and our aim is that how we can bring this to each and every patient bed and to every Bharatiya. That's our ambition.
What is the landscape of health in AI in India as compared to the world?
So in India, healthcare landscape is pretty different from that of world, right? I would say. Before I come to AI itself, right? First, the problem itself, right? So we are dealing with a very diverse population and a big population, right? 1.5 billion people we are talking about, and over and above that, we are talking about delivering this at almost 1/20th, 1/30th the cost at which typical healthcare systems in the West are delivering this kind of a quality care. Over and above this, our insurance penetration, which is at the lower level, and so on, right, poses a lot of challenges which we have, right. Above that, things like increasing non-communicable disorders, aging population, these are different challenges that we have as a healthcare system, and that's where the role of technology comes very important, right. That we have to find genuinely new methods to identify how technology can act as a force multiplier to our very talented field force, right? Healthcare professionals like doctors, nurses, but delivering this to 1.5 billion people will mean we need to create a force multiplier, and that's where the role of technology as well as AI comes into the picture. And the best part is when we crack this model, right? When we actually identify how to solve for this, how to deliver healthcare to 1.5 billion people, India will have a key to deliver healthcare to the world as well, right? Because this is 1/5 of the world we are talking about. Because when India innovates, right, it innovates for the world that way.
So what's the next step for Dozee in the upcoming future for the Indian state?
So now that we have seen a brilliant adoption in the private healthcare space in India, right, our ambition is first where there is a bigger mass is actually public health, right? That's where almost 80% of our population is. And when we transform healthcare system there, imagine a system like Dozee which drives digitization at scale combined with ABDM, right? It can help us with even things like policy making, see things like epidemiology, right? Things like those are enabled when systems are deployed at scale. The second frontier is patients are not just in the hospitals, right? They are discharged, they are also dealing with their conditions at home as well. So the next innovations are also coming up for home monitoring as well, especially for the aging population and for chronic conditions. And given that we now have world-class certifications like FDA 510K, we have HIPAA, SOC2 and so on, we have also started our journey outwards as well, because this is a world-class product with a dream of made in India for the world. And we have already started our outposts in the US, in UAE, in Africa, right, apart from driving transformation in India, right? So we want to ensure that India delivers not only for herself, but India delivers for the world as well. So yeah, thank you.
Thank you.